In this chapter, we are going to dive deep into a topic that's often misunderstood but incredibly important when it comes to managing constipation. Laxatives. Whether you are used them before or are considering using them or simply want to understand more about how they work, this discussion will provide you with a comprehensive understanding of how different types of laxatives, how they function, and most importantly, how to use them safely. So let's start with the basics. What exactly are laxatives? At their core, laxatives are substances that help stimulate or facilitate bowel movements, relieving constipation. They work by different mechanisms to either speed up the passage of stool through the intestines, soften the stool, or increase the frequency of bowel movements. Laxatives come in various forms, including tablets, capsules, liquid powders, and even suppositories. Is designed to address specific types of constipation or individual needs. The role of laxatives is to provide relief from the symptoms of constipation. However, it's important to understand that laxatives are generally intended for short term use, not a very long term solution. While they can be incredibly effective when used appropriately, misuse or overuse of laxatives can lead to dependency and other health issues. That's why it's crucial to have a clear understanding of how each type of laxative works and the appropriate context for their use. So let's break it down. There are five main types of laxatives, each with its own mechanism of action. These include bulk forming laxatives, osmotic laxatives, stimulant laxatives, stool softeners, and five lubricant laxatives. Understanding how each of these works will help you choose the right one based on your scientific specific needs and circumstances. First off, we have bulk forming laxatives. These are perhaps the most common recommended type of laxatives, especially for those who experience chronic constipation. The bulk forming laxatives work by increasing the bulk of stool, which helps it pass more easily through the intestines. They are essentially natural or synthetic fibers that absorb water in the gut, forming a soft, bulky stool that can be passed more easily. So, one of the most well known examples of bulk forming laxative is psyllium husk, which is active ingredient in products like metamucil. Psyllium is a soluble fiber, meaning it absorbs water and forms a gel like substance in the digestive tract. This not only helps to soften the stool but also adds bulk, which stimulates the natural contraction of the intestines, known as peristalsis, peristalsis, to move the stool along. Other examples of bulk forming laxatives include methyl cellulose and polychlorophyll. It's important to note that when using bulk forming laxatives, hydration is key. These laxatives rely on water to do their job effectively. Without adequate fluid intake, they can actually worsen constipation by making the stool harder and more difficult to pass. So, if you are using bulk forming laxative, make sure you are drinking a plenty of water throughout the day. Next, let's talk about osmotic laxatives. Osmotic laxatives work differently from bulk forming laxatives in that they help to draw water into the intestines, softening the stool and making it easier to pass. They achieve this by increasing the amount of water in the colon, which helps to stimulate bowel movements. One of the most commonly used osmotic laxatives is magnesium citrate. Magnesium citrate is an over the counter remedy that works by drawing water into the intestines through a process known as osmosis. This increase in water content not only softens the stool but also triggers the colon to contract, helping to move the stool along. For other examples of laxatives include polyethylene glycol, commonly known as Miralax, and lactulose, which is often prescribed for more severe cases of constipation. And osmotic laxatives are generally effective and work relatively quickly, often within a few hours. However, they do come with some potential side effects. Because they draw water into the intestines, they can sometimes lead to dehydration, especially if not enough fluids are consumed. They can also cause electrolyte imbalances, particularly with long term use, which is why it's important to use these laxatives as directed and not for extended periods without medical supervision. And moving on to stimulant laxatives, these are perhaps the most potent type of laxatives and are typically used when laxatives have not been other laxatives have not been effective. Stimulant laxatives work by directly stimulating the nerves in the intestine, causing the muscles of the bowel to contract more frequently and forcefully. This increased muscular activity helps to push the stool through the intestines more quickly. Bisacodyl, found in products like Dulcolax, is the most commonly used stimulant laxatives. Another example is senna, which is derived from leaves of senna plant and is available over the counter in various forms, including tablets and teas. Stimulant laxatives are known for their quick action, often producing the results within 6 to 12 hours. While stimulant laxatives can be highly effective, they are also associated with some risk, particularly with the long term use. The most significant risk is dependency, because stimulant laxatives force the bowel muscles to contract. Over time, the bowel can become reliant on these external stimuli to function. This can lead to a condition known as laxative dependence, where the bowel loses its natural ability to contract and move stool through the digestive tract without the aid of laxative. In addition to dependency, stimulant laxatives can also cause cramping, dehydration, and electrolyte imbalances. For these reasons, stimulant laxatives are generally recommended for short term, very short term use and should be used with caution, especially in individuals who are already at risk of these side effects. Now, let's discuss stool softeners, which are often recommended for people who need to avoid straining during bowel movements, such as recovering from surgery, childbirth, and or hemorrhoids. Stool softeners work by helping to mix water and fats into the stool, making it softer and easier to pass. Unlike other types of laxatives, stool softeners don't stimulate the bowel to move. Instead, they focus solely on softening the stool to ease its passes. Docusate sodium, commonly known by the brand name Coles, is one of the most widely used stool softeners. It's gentle and typical works within 1 to 3 days. Because stool softeners don't stimulate the bowel or draw water into the intestines, they are generally considered safe for regular use, particularly in situations where straining could be harmful. However, it's important to understand that while stool softeners can be helpful in certain situations, They are not always effective in relieving chronic or severe constipation on their own. They work best as part of the broader treatment plan that might include other types of laxatives or lifestyle changes, such as increased fiber intake and regular physical activity. Finally, let's talk about lubricant laxatives. These laxatives work by coating the surface of the stool and inside of the intestines with a slippery film, which helps the stool pass more easily to the digestive tract. Lubricant laxatives are typically used when there is immediate need for relief from constipation, as they work quickly, often within a few hours. Mineral oil is the most common lubricant laxatives, is available over the counter in both liquid and enema forms. Because it works by coating the stool and intestines, it can prevent the absorption of water from the stool, keeping it soft and making it easier to pass. While lubricant laxatives can be effective for short term use, they are not without risk. One of the main concerns with the long term use of mineral oil is that it can interfere with the absorption of fat, soluble vitamins such as the vitamin A, D, E, and K. This can lead to deficiencies over time. Additionally, if mineral oil is aspirated into the lungs, it can cause serious condition known as lipoid pneumonia. For those reasons, lubricant laxatives should be used with caution and only for short periods. So, one other thing that I use daily is I eat a tablespoon or teaspoon of ghee first in the morning. That can also as a very safe lubricant, which is also a natural fat. Now that we have covered different types of laxatives and how they work, it's important to address some of the common misconceptions about laxatives, as well as the potential risks associated with their use. One of the most pervasive misconception is that idea that a laxative can be used for weight loss. This is not only inaccurate but also dangerous. Laxatives do not help with weight loss. They primarily affect the colon, not the small intestine, where most of the nutrients and calories are absorbed. The weight loss that might occur from laxative use is mainly due to the loss of water weight, not actual fat loss. This can lead to dehydration, electrolyte imbalances, and potentially life-threatening conditions like cardiac arrhythmias. Another misconception is that the belief that taking laxative regularly is harmless way to maintain regular bowel movements. As we have discussed, prolonged use of certain types of laxatives, particularly stimulant laxatives, can lead to dependency and a decrease in the colon's natural ability to function. This can create a vicious cycle where increasing the doses of laxatives are needed to achieve the same effect, leading to further complications. It's also worth noting that all laxatives, when used improperly or overused, carry the risk of causing electrolyte imbalances. Electrolytes like sodium, potassium, and chloride are vital for many bodily functions, including maintaining proper nerve and muscle functions, hydration, and pH balance. Disrupting these electrolytes through excessive laxative use can lead to serious health issues, including heart problems and muscle weaknesses. So, what's the takeaway here? Laxative can be a useful tool for relieving constipation when used correctly and for the right reasons. However, they are not a long term solution, and their use should be approached with caution. It's important to identify the underlying cause of constipation and to address it with a combination of dietary changes, lifestyle modifications, and, if necessary, the appropriate type of laxative for your situation. And as always, before starting with any new treatment regimen, it's essential to consult with a healthcare provider, especially if you have the underlying health conditions or taking other medications. Personalized advice from medical professional can help ensure that you are using laxatives safely and effectively without putting your health at risk. And in the next part of our episode, we will explore how to personalize laxative use based on your specific needs, as well as the role of the natural and Ayurvedic remedies in promoting digestive health. We'll also discuss how to incorporate these tools into a holistic plan that not only addresses constipation but also supports overall well being. Stay with us as we continue this comprehensive journey into understanding and managing constipation. I'm Bimal Maharjan, and you are listening to the Gosphere podcast.